Next month, I turn 26. And you know what that means, don't you? It's a big staple for a lot of us who are about to turn this age. It means we get kicked off our parents' health insurance. Hi, my name is Nishara, and I'm here to talk to you today about universal health care. We, the people, deserve universal health care as a human right. I work in a pharmacy, and I see the toll that our current healthcare system takes on our society. I've read dozens of articles about the pros and cons of healthcare, universal healthcare, and honestly, the pros outweigh the cons. Currently, millions of people go without healthcare, and this is why it should be free and accessible to everyone, and with no extra cost. First, I would like to talk to you about the problems with our current healthcare system. Our current healthcare system relies heavily on private insurance companies. According to the Commonwealth Fund, 67% of Americans have this type of healthcare. 55% of this is employer-based, meaning they're insured through their employers. However, before they can even get coverage, they have to pay down a deductible. The average deductible for an American is $1,846 per year. And so let's talk a little bit about Medicaid. According to HHS.gov, Medicare is a service for people above 65, people with disabilities, and people with end-stage renal disease. For example, doctors can prescribe diabetes supplies through Medicare, but they won't be able to get them because they prescribed the frequency too high, so the insurance doesn't want to cover it. So that means that they have to go back to their doctor and get a different prescription. So they could go days without getting their prescription for their diabetes supplies. And according to the AAFP, the U.S. focuses on intervention treatment versus preventative care. Preventative care means that you work on preventing diseases, and intervention means taking care of people who have already gotten sick. The CNBC states that insurance costs over the past decade have gone up 71%, versus the minimum wage, which has gone up only 26% in the last decade. And if you're on state coverage, your ability to see a specialist goes down because the reimbursement rates are so low. So, secondly, if other countries can do it, so can we. We need to work towards universal health care for everyone. According to the International Insurance, the UK has free healthcare for everyone. About 18% of their taxes go towards healthcare. And according to the CNBC, the average American spends $7,188 a year on health insurance. And according to the Commonwealth Fund, some countries have a single-payer plan that covers everything, just like the UK. The US has proposed plans like this that would cover medical, dental, and vision. There wouldn't be a need for 4 different health plans. RX prescription costs would go down. There would be a cap on spending. For example, the Commonwealth Fund says that if you hit $221 for that year, you don't have to pay any more for the rest of the year on health coverage. And lastly, the benefits would be numerous. The growing pains would be worth it. The US dollar would be spent more efficiently. People right now complain about having to pay taxes to cover other people's health insurance, but that would go away because everyone would be under the same health insurance. The money would move from private health insurances to a wider range of other problems. And every citizen would be insured. There would be no tax penalties if you don't have insurance at the end of the year. There would be no more major medical debt if you don't have health insurance and you get hurt or you need care. And finally, universal health care is a human right. Everyone should have free access. According to the Washington Post, previous presidential candidate Andrew Yang believes in this too. He says that we need to move away. He understands that we can't just drop all the private insurance companies, but we eventually need to squeeze them out. So vote Andrew Yang. There is a major financial and emotional crisis when it comes to our current healthcare system, and that needs to change. Some could even say we need change now. Thank you.